All right, so today we are going to talk about GLP-1 medications and weight loss. First, I wanted to introduce myself. I know some of you have probably met me before or talked to me about nutrition in the past with Custom Fit, but just to briefly introduce myself, my name is Tarah Valenti. I am the Director of Nutrition at Custom Fit. I am a registered dietitian. I'm also a certified DEXA tech. So basically that means that I can use X-ray to do bone density and body composition measurements on people. I am also a personal trainer. And I specialize in body composition optimization. So that usually looks like reducing body fat, increasing muscle mass, or doing a little bit of both. I also specialize in nutrition for longevity, and I help people establish sustainable wellness habits. When I am not talking about food, I'm usually out doing long distance running, hiking, or traveling when I can. Okay, so our agenda for the day. We are going to start by talking about what GLP-1 medications are and how they work, who is eligible to be prescribed GLP-1 medications for weight loss, what studies have shown regarding the efficacy of GLP-1 medications for weight loss, and common side effects reported and common side effects that I have seen with my patients who are taking GLP-1s, dietary strategies and concerns, and how working with a registered dietitian can potentially help if you are taking a GLP-1 medication for weight loss. So what are GLP-1 agonist medications? GLP-1 actually stands for glucagon-like peptide 1. So Ozempic, Wegovy, and Saxena are the GLP-1 medications that are most often mentioned in the media at this time. I think most of us have heard of Ozempic. Many of us have heard of Wegovy. Saxena is a little bit less well known, but it is on the market for a similar purpose. Glucagon-like peptide 1 agonists are a class of medications that are used in the treatment of type 2 diabetes and in some cases obesity. GLP-1 is actually a hormone that's naturally made in our intestines. So everyone listening to this right now, you actually have GLP-1 in your body in this moment, whether you're taking a GLP-1 exogenously or if it might just be being produced naturally. This hormone targets areas of the brain that regulate appetite and food intake, and it also plays a role in insulin secretion, hence it being used as a diabetes medication. So the mechanism of action, basically how does this work? GLP-1 has an effect on insulin and glucagon. Those are the two main hormones that regulate our blood sugar in our body. And it also can cause delayed gastric emptying, meaning that your stomach empties a little bit slower than it normally would. So you can see how this might lead to a feeling of fullness because your stomach gets full and it's not emptying itself out quite as quickly as it used to. It also has an action on the hypothalamus and promotes satiety or a sense of fullness. It can cause a reduction in visceral and subcutaneous fat. Visceral fat is the fat that is in your abdominal cavity surrounding your organs. Sometimes people just call it the bad fat. A little visceral fat is totally okay and natural. We all should have a little bit of fat in our abdominal cavity, but when that number gets a little bit too high, it means that we're at a higher risk for conditions like diabetes and cardiovascular disease. Subcutaneous fat is just the fat that we think about when we think about body fat, so the stuff that you can pinch and feel. There are a variety of actions in other body systems as well, so your cardiovascular system and your other organs, but we won't be diving too deeply into that today. When are GLP-1 medications indicated for weight loss? So there are two GLP-1 agonist medications that have been approved for use for weight loss by the FDA in the United States. The other GLP-1 medications are approved for use for diabetes management. Wegovy, and it's also known as semaglutide, as well as Saxena, have been approved for use for weight loss in the US by the FDA. They were both approved in 2014 for chronic weight management in adults with obesity or overweight. with at least one weight-related condition, such as high blood pressure, type 2 diabetes, or high cholesterol. And they always specify for use in addition to a reduced calorie diet and increased physical activity. I think what they're trying to get at with that addition there is we want to focus on health and habits along with taking this medication. I think that it's a lot more complicated than just a reduced calorie diet and increased physical activity, which is something that we'll dig into momentarily. This drug is indicated for chronic weight management in patients with a BMI over 27 who have at least one weight-related ailment like the ones I mentioned before, or in patients with a BMI 30 or greater. So BMI is one of the key indicators that your healthcare provider will use to determine whether or not you're eligible for this medication. Who might not be eligible to take GLP-1 for weight loss? So again, BMI is one of the main criteria. If your BMI is under 27, you're technically not eligible to be taking a GLP-1 for weight loss alone. That does not mean you're not eligible to take it for diabetes management. That could be a possibility. That would be something you would need to consult your doctor about. But if you do not meet the BMI requirement, then you're not eligible to take GLP-1 for weight loss. Or if you don't have one of those weight-related health conditions with a BMI over 27. Patients with a personal or family history of specific medical conditions are also not eligible to take GLP-1. I've listed the different medical conditions here. That is something that, again, your doctor would just screen you for and let you know, are you eligible or are you not eligible? The other thing is just clinical judgment between you and your doctor. Your doctor knows you and knows a lot about these medications, ideally, and you two can kind of make a decision about whether or not taking one of these for weight loss is appropriate for you. Everyone's a little bit different, so clinical judgment plays a role as well. There are some challenges and barriers with taking a GLP-1 medication or beginning to take a GLP-1 medication. One of them is affordability and insurance. So not all insurance companies will cover GLP-1 medications for weight loss. I've heard about this happening more and more in the last year or so. And Wegovy specifically, I know that the out-of-pocket fees can be quite high. From what I've heard, it's over $1,000 a month if you're paying out of pocket. So there could be a financial barrier even if you are eligible to taking the medication or to take the medication. Some people don't respond well to the side effects of the medication, and we'll talk about what those side effects are in a minute here. But I definitely have worked with people who have began taking Wegovy or Ozempic, and they just didn't feel well. The side effects were too much for them, and they actually ended up discontinuing the medication for that reason alone. Also, medical reasons, like I mentioned previously, and then there basically is a risk that you'll have to take this medication indefinitely in order to maintain the weight loss. Again, that's not across the board. That doesn't mean everybody has to take it forever, right? But getting off of these medications can cause weight regain. And so some people might need to take them for long duration periods of time. What the research says so far. So Wegovy's safety and efficacy were studied in 4 68-week trials. More than 2,600 patients received Wegovy for up to 68 weeks in these 4 studies. 68 weeks is a pretty long time. And then 1,500 patients received a placebo. Study participants that received the Wegovy lost between 6.2 and 12.4% of their total body weight, which is considered significant. Wegovy was also found to have cardioprotective potential. Semaglutide, aka Wegovy, not only showed improvement in diabetes and body weight, but also lowered the rate of cardiovascular death, non-fatal heart attack, or non-fatal stroke in patients with type 2 diabetes at high risk of cardiovascular disease. So we've got the reduction in body weight, but then there's also other potential benefits that can come not only from a reduction in the weight, but potentially from taking the medication. So side effects. The side effects for me in my practice are what I spend most of my time managing. The most common side effects that are listed here, the first ones are all the ones that are on the FDA website. And I've definitely seen these with folks that I've worked with. If you or someone that you know is taking one of these medications, you may also be familiar with these side effects as may have witnessed them. And then the ones with the asterisks next to them are the ones that I see the most in my practice and that I help my patients navigate the most often. So nausea, vomiting, diarrhea, constipation, abdominal pain, headache, fatigue, indigestion, and dizziness are the ones that are listed on the FDA website. For me, what I find that I help the people I work with navigate the most often, it's food aversions, very low calorie intake, and loss of muscle mass if nutrition and exercise are not well managed. So you can imagine how all three of these things kind of go together. So with food aversions, I have seen folks just suddenly, the appetite is down already, but certain foods just sound very unappealing. Particularly, I've noticed a trend with animal protein being something that is not appealing. People will lean more toward plant-based foods. Sometimes eating foods that are high in fat can be challenging. It makes people feel too full and maybe a little nauseated. And so we have to make sure that we navigate these food aversions and try to make sure that we optimize nutrition because of the bullet below the food aversions one, very low caloric intake. So in some of the people that I work with, their appetite is dramatically reduced to the extent that they're consuming very few calories. And the concern with this is that when you're eating such a low amount of calories, it's much more important to optimize those calories. So if you're having the food aversions, you're not eating very much food, it increases the likelihood that you're getting insufficient nutrients in general, which for a temporary short period of time maybe isn't a big deal. But if it's going on for many months, now we're at a risk for vitamin deficiency. We're at risk for not getting sufficient calcium to support our bones. We're at risk of losing muscle mass along with body fat. And so that's something that we at Custom Fit, we use a DEXA scanner to monitor these things and, hope to mediate some of these side effects. So working with a dietitian can help you navigate these things. So if you or a loved one is taking one of these medications and you're concerned about your overall health, working with a professional to help make sure that you're checking off all of those nutritional boxes can be absolutely essential, not just in making sure that your body is getting all of the nutrients that it needs and you're doing the best that you can, but also in just making you feel good. So, with weight loss, you're going to start feeling better. But if you're not getting sufficient nutrients, if your macronutrients aren't balanced, if you're not getting fiber, if you're not getting all those vitamins and minerals that you need, if you're not supporting gut health, you're not going to feel great. You're not going to be functioning at your best. And the longer that goes on, the higher the likelihood that you'll start feeling unwell. So for most people who are taking these medications, I do recommend at least meeting with a dietitian so that you can make sure you're checking off all of those boxes, make sure you're eating sufficient nutrients to maintain bone density, getting adequate protein, carbohydrates, and healthy fats, preventing vitamin deficiencies, and also potentially identifying foods that you can eat while navigating food aversions. So one of the things that I'll often recommend if people are feeling averse to like animal protein and meat and stuff is doing things like smoothies. So you can get a heavy dose of good fruits, potentially vegetables, protein, and it's easy to consume because it's a beverage. There are foods that actually naturally increase GLP-1 production. So if you are not taking a GLP-1 medication, if you're thinking about it, but you're not quite there yet, one of the things that I like to start with is focusing on a balanced diet in general, because a lot of these foods actually help your body to naturally increase GLP-1 production. And if your body is making sufficient GLP-1, it will have those same effects that the medications have on you, just to a lower extent, right? So you will have appetite suppression. The stomach will empty a little bit slower if you're getting a normal amount of GLP-1. So whole grains, lean proteins, healthy fats, fermented foods are all things that we want to be getting into our diet on a regular basis if they agree with you. So balance is key here, as I always say. So it can be very helpful to have some data to support you on this journey, whether you are losing weight with a GLP-1 or without a GLP-1. But particularly if you are taking a GLP-1 medication, getting a DEXA scan to assess your amount of muscle mass and body fat and visceral fat in the beginning, like when you, ideally before you start taking it, right? But at least in the beginning, so that you know what your starting point is, can be really helpful in making sure that you're losing the right kind of weight. So you can check to see where your bone density is at, see where your muscle mass is at, and get a measure of your body fat and visceral fat. Do a follow-up scan and see what's happening in your body. Are you losing sufficient? Are you losing a significant amount of muscle mass? Are you losing mostly body fat? Is it a combination of both? If so, what's the ratio? And from there, we can make sure that you're covering your bases from a nutrition and exercise perspective to minimize loss of muscle mass, maximize loss of body fat, but also make sure that it's happening at a rate that is healthy and not too quick. It's also really fun to track progress. So, you can kind of see how far you've come. It can feel really inspiring and empowering to see an increase in muscle mass, a loss in body fat, and just a shift toward a more optimal body composition where you feel more like yourself. Another thing that I do and the other dietitians I work with do to make sure that our clients who are on a weight loss journey are checking off all of their nutrition boxes and optimizing their health is tracking in an app. So we use this app. It's called Better, short for Practice Better. And with that app, we give our clients customized calorie and macronutrient recommendations, along with potentially micronutrients as well, and usually fiber too, to make sure that, again, you're checking off all of those nutrition boxes, optimizing the calories that you are able to get in, maintaining a moderate caloric deficit, ideally nothing too extreme. And we're able to see everything that you're doing in the app. So we can look at the balance of your meals and snacks. We can offer up suggestions. We can really strategize together to make sure that you're able to optimize your nutrition, hit your goals, and ideally maintain, if not increase muscle mass, if that's a goal for you, while you're losing body fat. So it's really about optimizing from every possible angle. Again, weight loss without GLP-1 medications is totally possible. I've been doing this for a very long time, long before these became a mainstream strategy for weight loss. And really, the approaches are going to be different, whether you're taking GLP-1 or you're not taking a GLP-1. But generally, what we're looking at is focusing on sustainable changes. So things that are not extreme or a crash diet. We're not eliminating entire food groups or anything like that. We want sustainable changes that can last a lifetime. We like to start by monitoring nutrient intake. Pay close attention to what your intake is looking like. Focus heavily in the beginning on optimization, and then eventually it becomes more like a habit, more automatic, and it gets easier. But we do that through clear, customized targets, so you know exactly what to do. Also, starting with small goals can be a really good starting point, and then kind of layering on from there, changing habits one day at a time. And of course, there's going to be that consistency piece, which is the challenge for most of us, right? So life makes it difficult. And that is something that I help people to navigate on a daily basis. So how do we make our nutrition goals fit within our very busy, ambitious lifestyles? So there's that kind of that accountability and support piece that can be super essential in working together. Bottom line, GLP-1 is a hormone produced naturally in our intestines. So there are some foods that we can consume to naturally support that production. And there are some medications that, if you are eligible and you and your doctor think that it's a good idea, you can take to increase GLP-1 in your body so that it can reduce your appetite, cause delayed gastric emptying, and do other things to make it a little easier for you to reduce your caloric intake and lose weight. Again, the eligibility criteria, insurance coverage, and other factors mean that not everyone is going to be able to get GLP-1s, and not everyone should be taking GLP-1s. It should not necessarily be like our first choice. I think that diet and lifestyle change should be number one, and then if that is not effective, possibly a GLP-1, depending on the individual case. But weight loss can be achieved either way. It just depends on whether you're using a GLP-1 or whether you're not using a GLP-1, so that we can tweak the approach to make sure that we're doing whatever is going to work best for you so that you can hit your goals and your targets. Monitoring things using a DEXA scanner, using an app so that we can track your nutrition intake. There are plenty of different ways where we can kind of look at data and let that inform our recommendations. Can be really helpful. And as I mentioned before, kind of empowering and inspiring to see the measured change that's based on health-related measurements rather than just the number on the scale, right? Because weight loss is one thing, but what kind of weight are we losing? And how does that affect us? So nutrition guidance can help to maximize your nutrition and optimize things from that perspective, but it can also help to minimize the risk of nutrition-related health concerns as you take a GLP-1 or as you put yourself in a caloric deficit to achieve a weight loss goal. So if you are interested in talking a little bit about weight loss, body composition optimization, nutrition for longevity, or anything that really falls under the umbrella of what a dietitian does, you can use the QR code here to schedule a session with myself or one of my colleagues. We have 3 registered dietitians on staff, as well as a holistic nutritionist. Everyone is amazing. I might be a little biased. But we would love to chat with you about how to strategically target your goals and get you where you want to be so that you can feel a little bit more like yourself. And if you are taking a GLP-1 or you do begin taking a GLP-1 medication, it would be a good idea to at least hop on for a free consultation so that we can talk about how to navigate what you might be feeling as you begin those medications. I will also just throw up my references that I used for my information that I shared with you all today, and bring it on back to the QR code in case you want to schedule a session. I'm going to stop recording now and take any questions.